Welcome to Behavioral Health Davidson. We're glad that you've chosen us to help start you on your journey towards healing. At Atrium Health, our mission is to improve health, elevate hope, and advance healing for all. And that is especially true here at Behavioral Health Davidson. We are a psychiatric hospital specializing in the care of patients with depression and bipolar disorder, as well as other psychiatric illnesses. The average stay with us is 6 days, and while you're here, you'll be cared for by a variety of healthcare professionals, each with a specialized role designed to improve your health and well-being. This video will introduce you to the roles your care team will cover and also introduce you to our facility and the many amenities on our campus. Our number one priority is to give you the best care possible and to keep you safe and comfortable during this crisis. Our hospital provides 24-hour nursing care on all 3 of our units, which are each designed to provide the resources that are specific to your needs. These units all have 22 individual rooms with their own private bathroom. All of our units have dedicated staff to care for you. Each unit is locked at all times to maintain your safety and privacy. You will receive a special access code, which you can give to your friends and family if you would like to speak to them while you're here, or if you would like for us to give them information about your care. This is to protect your confidentiality and privacy. You will be assigned to a unit best suited to your physical and psychological needs. Sometimes the unit that best meets your needs may be in a different location than when you first arrived here for care, and we may move you to the most appropriate setting to make sure you get the best care possible. We want to familiarize you with our facility. As you travel through our campus, you will notice many safe zones. This whole hospital was designed using state-of-the-art technology to make sure that we can keep you safe at all times. You may hear alarms during your stay. This is our way to communicate between teammates so that we can optimize safety for our entire campus.
Code, response, River Birch.
Each teammate receives annual training on responding to these alarms, so don't worry, you are safe in our care. Should an emergency situation arise, we will direct you to safety. You will receive a welcome packet that contains additional information, including a unit schedule. This will let you know when your unit is holding various activities, including meal times. We know your family and loved ones are vital to your recovery, and they will be able to visit you each day during certain hours. The visiting time is restricted so that we can maximize your psychiatric care and get you ready to transition back to your home. We only have a few days with you here to help set you on a path towards recovery, and we want to make the most of it. So let me introduce you to the rest of the care team who will be working with you throughout your stay. Medical doctors. As with any hospital, medical doctors, specifically psychiatrists, physician's assistants, and nurse practitioners, are here to help. They will meet you within 24 hours of your admission and are genuinely interested in hearing your story. They want to know about what brought you here to the hospital, your medical history, family history, previous psychiatric treatment, drug usage, and home stressors, whatever applies to your unique situation. They will talk with you about medication and therapy options and decide on the best way to treat your symptoms. Psychiatrists, nurse practitioners, or physician's assistants will see you daily during your stay. Please talk openly and honestly with them about your progress here, your mood, sleep and appetite, plans after discharge, and your response to medication. Social workers. The Behavioral Health Davidson Clinical Department consists of peer support specialists and master's level licensed therapists. The team plays a vital role in nearly every aspect of your treatment. Therapists meet with you when you first arrive to conduct a thorough intake assessment and develop a treatment plan, and will continue working with you daily until your discharge. The therapist team leads group activities like safety planning, skills building, and psychoeducation and treatment interventions, and also individual sessions to address mental health symptoms, daily functioning concerns, and they help to facilitate discharge and arrange follow-up visits. The therapist is also the primary bridge between you and your friends and family members. They will conduct family therapy sessions and serve as a resource to your loved ones during your stay. Also on the social work team is the peer support specialist, who is in the midst of their own successful recovery from substance use and behavioral health concerns. This peer is someone you can relate to, who can help inspire and educate you by sharing their own stories and providing invaluable resources and support. They can also help you access needed support systems and community agencies while encouraging you to maintain your motivation for recovery and to follow through with aftercare plans. RNs, psychiatric technicians, and secretaries. Your registered nurse will meet with you every day and will manage your inpatient stay. This includes completing a daily mental and physical health assessment, administering medications and treatments as prescribed by your doctor, and ensuring your safety and well-being. Your nurse, along with your social worker, will be able to answer most of your questions during your hospitalization. Our psychiatric technicians are also in the hospital 24 hours a day and are here to monitor patient behaviors, help with your daily activities, assist with your discharge planning, and ensure a safe and secure environment. Our unit secretaries, who are also trained as psychiatric technicians, make sure that each of the units runs smoothly. They are on the unit to help support your behavioral health care team and can answer many of the questions you may have during your stay. Dietitiary team. An important part of the healing process is healthy eating, and Behavioral Health Davidson has a whole dietary team in place to manage the food you eat and your nutrition. This team of dedicated specialists makes sure all patients are served a balanced and nutritious meal with love and care. Dietitians will work directly with the care team to accommodate individual requests if they are formally written in their dietary meal orders. They can also educate you on different options that you might not know. Our goal is to give you a great meal with a smile and help you with healing and give you great food. Recreational therapists. Recreational therapists use specialized interventions to address your individual needs. The treatments are designed to restore, remediate, and rehabilitate you and improve your overall quality of life. At Behavioral Health Davidson, the recreational therapist will complete a thorough assessment when you arrive, will work with you to develop goals, and will provide daily group and one-on-one therapy. The therapies are designed to help you clarify your values, learn some communication skills, develop ways to problem solve, and help you improve your self-esteem, just to mention a few. Our recreational therapists will provide you with opportunities for physical activity to explore your healthy interests and to help you develop social skills, learn ways to manage stress, relax, and concentrate. All of these things will help increase your confidence and get you ready to transition back to your life. Security. Security for everyone is an essential part of the healing process. Our security officers are trained during their basic academy that patients have the right to heal in an atmosphere free of disorder and chaos. Our officers are charged with ensuring and maintaining a safe environment for patients to heal and recover in while at our facility. During the day, officers will round on the floors to ensure a safe environment. Additionally, officers monitor video surveillance cameras to ensure your safety in common areas. Officers are an integral part of the patient care team. They can answer your questions about the criminal justice system or involuntary commitment status. Chaplains. When facing a crisis, people often turn to their spirituality as a means of helping to maintain health or cope with illnesses, trauma, losses, and life transitions by integrating body, mind, and spirit. Our chaplains are trained in the art of compassionate listening and healing presence. They assess in their listening for ways to help you find meaning and connection to transcendence, to assist in meeting your religious needs, and by providing compassionate support as you work toward both wellness and rebuilding relationships. Pharmacist. Sometimes medication is necessary to aid in the healing process. Inpatient pharmacists work together with your care team and your treatment plan to optimize drug therapy in a cost-effective manner. Pharmacists are responsible for order verifications and assisting nurses with medication management. Our pharmacists will also coordinate your discharge medication with our outpatient pharmacy, including handling prior authorizations and patient medication counseling at discharge so that your healing can continue after you leave our campus. Everything we do here is designed to help you heal and set you up for a successful transition back to your life. When you are ready to go home, we will arrange your outpatient care and medication prescriptions. Our goal is to have you ready to go home before 12 noon so that you have time to get settled and we can get your room ready for another patient who needs our care. So please let your family know so that they can plan to be here in the morning of your discharge. Welcome to Behavioral Health Davidson. We're glad you're here.